Welcome back to Inspire Great Health. I have Dr. Daniel Kisicki with me today. He is a primary care sports medicine physician with CRMG's Orthopedics and Surgical Specialist Clinic. How are you today, Dr. Kisicki?
I'm good. How are you?
I'm doing fantastic. Thank you so much for joining me.
Thank you for having me.
So I just want to get to know you a little bit better. Tell me a little bit about yourself, where you're from, where you received your education, and how you ended up joining us here at CRMG.
Of course. I'm actually from Cheyenne originally. I was born and raised here in Cheyenne. I attended Jessup Elementary and McCormick Junior High School, and graduated from Central High School.
Same.
Went off to college at the University of Wyoming over in Laramie and graduated with honors with a degree in molecular biology years ago, and then continued my education through the University of Colorado School of Medicine down in Denver. After that, following graduation from medical school, I then went on to a family medicine residency in Southfield, Michigan, in the Detroit area. Graduated from that, and then did a 1-year primary care sports medicine fellowship through the same hospital system out there in the Detroit area. After which I moved back here to Cheyenne in 2012 and began my career here with CRMG.
All right, perfect. So just an all-around Wyoming guy.
I am.
Yes.
Born and raised, a lot of family, friends still around this area. Just it's always kind of been my home, and I'm honored to come back to the community that I grew up and still be a part of the community, see and treat patients, friends that I grew up with, teachers that I used to have, all of those things. It's really kind of a neat aspect of the job.
That is neat. I bet it's neat for them as well.
I hope so.
Yeah.
I have some really good interactions, and it's just great to run into people that know my friends and family around the area or who have known me over the years, and I know them, and it just adds an extra aspect of it, an extra touch that just makes it very personal, and I'm incredibly proud and fortunate to have that opportunity to come back and give back to the place that helped me get to the point I wanted to in medicine and in life in general.
That's what's great about Cheyenne. It's a small community, but a big enough city, but a small community is what I like to say.
Absolutely. We have some great resources here. We're very fortunate to have some of the resources that we have in a town this size, but also we get that small town feel. And it was a lot of the reason I wanted to come back and raise a family here and be, a part of the community still.
Yeah, well, that was actually kind of answering my next question, was what do you love about Cheyenne Regional Medical Group? Do you want to expound on that at all?
I've been very fortunate to have them allow me to develop the practice that I want to over the years. As I said, I did my training in family medicine and always had an interest in sports medicine. I always wanted to kind of go into that field dating back many, many years ago. I started out when I first moved back here, I was a primary care provider at Cheyenne Family Medicine, and then spent a portion of my week at what was Wyoming Orthopedics and Sports Medicine, our previous orthopedic group. And then over time, I was able to continue to increase my time at the orthopedic office doing primary care sports medicine, which has always been kind of my main passion. And then around 2018, I pretty much went full-time with the primary care sports medicine, and CRMG allowed me to grow that practice and really become the kind of provider and treat the type of patients that I really wanted to over time. So I really appreciate the support and opportunities that they've allowed me over the years in that realm. So it's been just a great opportunity over the years to continue to develop and grow programs that we have with the area high schools, as well as with just the patient population that I love to treat.
Yeah. And also, again, you kind of already answered my question, but what is your area of expertise as a sports medicine doctor? What do you kind of focus on?
So I'm a non-operative sports medicine doctor. In other words, I don't perform surgeries, but I care for really athletes and non-athletes of all different ages and all different areas. So from younger patients to especially junior high, high school, even collegiate level athletes that participate in recreational activities or in high level competitive sports and things like that, as well as treat the weekend warriors that like to do different activities in sports, even the geriatric population that deals with arthritis or other chronic overuse injuries and things like that. I do non-operative minor fracture care, strains, sprains, any type of injuries that a patient may find themselves dealing with, whether it's a work-related injury or a sports-related injury or just something that happens throughout their daily activities and things like that. I also have additional training and interest in concussion management. So I see a lot of patients who, especially sports-related concussion in our young athletes, and help them manage those conditions, help them reintegrate back to school, return to learn programs, return to play programs, to allow them to get back to school, back to sports and things like that in a safe but efficient way. So we do a lot of concussion management in our field as well.
So you focus a lot on education as well, educating patients on how to care better for themselves.
Absolutely. I'm a big believer in bringing patients into their care and involving them in their care. I'm not one that likes to just tell patients what to do. I like to have people help understand what's going on and what got them in that situation and how they might be able to prevent it in the future or treat it or deal with it in different ways. So I always try to make sure I have a lot of education with my patients and utilize my support staff. I have an amazing support staff and always have through the clinics, whether it's our athletic trainers, our physical or occupational therapists, our other providers, our MAs, all of our staff there that helps with a lot of that patient education aspect of it as well. And to me, it's important for patients to kind of understand those aspects so that we can help get them back to doing what they love to do and hopefully help prevent it in the future as well.
And what would a potential patient, what should they know about your philosophy of care?
I like to, like I said, I like to engage the patient. I pride myself on being reachable and being able to hopefully connect with my patients well, listen to them, hear their side of the story, and again engage them in the process and things like that. It's scary when you have an injury or you have an unknown and to come in and be able to maybe alleviate some of those concerns, not only the patient, but if it's a younger patient, their parents or guardians or things like that as well. And just kind of roll our sleeves up and get to know what's going on, what they like to do, what their goals are, and then kind of, again, discussing those approaches that we can best implement to try to get them back doing the things that they love to do and utilize any of those resources that we have. And, at the end of the day, I want patients to feel comfortable coming to us, asking us questions, and being a key component in the process, because obviously they're the most important thing in the whole process, the patient themselves, and making sure that they do well.
What do you think makes you unique as a provider?
I think the blend that I have, my family medicine training, I had some amazing teachers and preceptors and role models over the years that I've been able to kind of bring different characteristics of their care and how they approach patients and over the years. And I feel like I had an amazing group of teachers over the years that I was very fortunate to learn from. And I think, bringing just those little aspects and still being human about it and being reachable and again, just sitting down with the patient and having those conversations and not having it be you have to do this, you have to do that kind of approach to where they can engage in their care and hopefully we can get them moving forward in whatever we need to in terms of the treatment.
Oh, well, that's great. Always helping those patients move forward.
Exactly.
So those are all the questions I have for you, but I do have a few fun questions to ask you.
Okay.
What is your favorite movie?
Oh, gosh. I'd have to say, and it was just the 30th, this just pops into my head, the 30th anniversary of it. So it was Tommy Boy.
Yeah.
And that takes me back. That probably dates me. But that's a movie I can quote almost the whole thing. So I'd probably say that since it was just recently, I think just last week was the 30-year anniversary of it. So
I'm also a huge Chris Farley and David Spade fan.
Absolutely.
So I can get on board with that.
Absolutely.
What's your favorite food?
Tacos.
Tacos.
I could
Good
pretty much
choice.
eat tacos, I think, almost every night if need be. So I'm a huge Mexican taco fan.
If you could go on vacation anywhere in the world, where would it be?
I'm not a huge traveler.
Okay.
I'm pretty simple. You give me a mountain getaway or something like that. I think it would be really neat to go to like the Alps or something like that and just like hide away in a mountain retreat for a week or something like that where it's nice and quiet and peaceful and things like that would be something fun.
Okay. And probably our most divisive question, cats or dogs?
Dogs.
Dogs. Fair enough.
Yeah.
Yes.
I'm a dog person more than a cat person.
Okay, totally fair. All right. Is there anything else you'd like to add?
I don't think so. I think that kind of sums up where I am.
All right. Well, thank you so much for joining me today. And be sure to join us next time.